If you've been told you need a root canal, the real question isn't whether to schedule it next Tuesday. It is whether you actually need one at all, and if you do, whether the way it's about to be done is the way that gives you the best possible outcome 10 and 20 years from now. Did you know you almost never actually need a root canal as urgently as you've been told? This is one of my biggest pet peeves as a dentist, and I want to walk you through it carefully today. In 25 years of practice, I have watched too many root canals get scheduled on Friday for Monday morning that, with one or two right questions, could have gone a very different direction. Sometimes a tooth that didn't need anything aggressive at all. Sometimes a tooth that did, but where a different option that no one had mentioned would have served the patient better. By the end of this video, you're going to know exactly what a root canal really is, what alternatives genuinely exist, and the 4 questions I would have you ask any dentist before you let one anywhere near your tooth. I'm Dr. Helen Bennett. 25 years in practice, the last 15 as a biomimetic and holistic dentist, which means my whole orientation is towards saving teeth in ways that respect the rest of the mouth and the rest of the body. Before we get into this, do me a small favor. Drop your city or state in the comments. I love seeing where you're watching from, and it helps me know who I'm sitting with today. And one important thing, everything I share is educational. It is not a substitute for in-person dental care. Use it to walk into your dentist's office with sharper questions and a clearer head, especially before a procedure as final as the one we're talking about today. Here's what's at stake when a root canal gets scheduled too quickly. Sit with this for a moment. A root canal is, by design, a permanent procedure on a permanent tooth. The nerve and blood supply inside the tooth are removed. The inside is cleaned and filled with a sealant, and a crown is usually placed over the top. That tooth is no longer alive. It is a structural tooth, not a living one. And while modern root canals can last for decades and serve people very well, they are not, and let me say this carefully, they are not the only option, and they are not without trade-offs. A root canal that is done well in the right tooth is a saved tooth. A root canal that is done in haste, in the wrong tooth, or when an alternative would have worked better, is the start of a longer story that ends in extraction 5 or 10 or 15 years later. The financial side is real too. We're talking about a procedure that runs in the range of $1,500 to $3,000 in most parts of this country, often more with the crown. That is not a small decision. And the truth most dentists won't sit down and tell you is that the question of whether you actually need it right now, this week, this way, is the most important question you will ask in your entire dental life. I don't tell you this to scare you. I tell you because no one else will. And about halfway through, I'm going to share the one question I wish every patient over 50 would ask before agreeing to a root canal. It has saved more teeth in my practice than any tool I own, and most patients have never heard it. Stay with me. Let me back up and explain what a root canal actually is, because the picture most people have in their head is wrong. The inside of a tooth is hollow. Inside that hollow space sits a bundle of nerve, blood vessels, and connective tissue called the pulp. The pulp keeps the tooth alive, sensing temperature, sensing pressure, and providing the immune support that helps the tooth fight off infection. When the pulp gets damaged or infected, usually from a deep cavity that reached the nerve, from a crack, from a major injury, or from repeated trauma, it can die. A dying pulp produces pain, sometimes severe, and if the infection moves out through the root tip into the bone, it produces a real abscess. That is the situation a root canal is designed to treat. The dentist removes the dead or dying pulp, cleans the inside, and seals the empty canals. That is real. That is sometimes the right answer. But here is where it gets honest. Not every tooth that hurts needs a root canal. Not every tooth with a deep cavity needs a root canal. And not every dentist is trained to think conservatively before reaching for the most aggressive answer. So I'm going to give you 4 questions in order that I want you to ask. The 4th one is the one almost no one asks. Question 1. Is the pulp actually dead or just inflamed? This is the question that matters most, and it's one of the most missed in all of dentistry. There is a major difference between an inflamed pulp, what we call reversible pulpitis, and a dying pulp. Reversible pulpitis is a nerve that is irritated, usually from a deep cavity getting close, from a recent procedure, from a crack, from trauma. It hurts, sometimes a lot, but if you remove the irritation, the nerve calms down and goes back to being healthy. Irreversible pulpitis is a nerve that has crossed a line. It is dying, or partially dying, and even if you remove the irritation, it will continue to deteriorate. The honest answer to which one is sometimes obvious. Extreme pain, swelling, an abscess on the X-ray, a tooth that is non-responsive to cold tests, and sometimes genuinely hard to tell. The right, honest answer sounds like, based on the symptoms and tests, I believe the pulp is irreversibly damaged because of A, B, and C. The red flag answer sounds like, well, you're having pain, so we should just do the root canal. Pain alone is not a diagnosis. Pain plus a careful examination plus pulp testing is. If your dentist cannot tell you specifically why they believe the nerve is past the point of saving, ask for a second opinion. Vital pulp therapy, keeping the nerve alive while treating the cavity around it, is a real, evidence-based option for the right kind of tooth, and it has come a long way in the last 15 years. Question 2. Have we tried to save the nerve first? This builds on the first one, and it is something many dentists outside of biomimetic practice still do not offer. If the pulp is inflamed but not yet irreversibly damaged, modern techniques can sometimes treat the source of the irritation and let the tooth heal. Removing the deep decay carefully, placing a biocompatible material directly over the exposed pulp, and giving the tooth time. In many cases, the tooth recovers, the nerve stays alive, and no root canal is needed. This is not guesswork. There is a body of research, much of it published in the Journal of Endodontics over the past 2 decades, supporting these techniques in carefully selected cases. A good honest answer here sounds like yes. In your case, the decay was already too deep, and the pulp tested non-vital, so a vital pulp therapy isn't likely to succeed. A red flag answer sounds like, we don't really do that here. That second answer doesn't mean your tooth needs a root canal. It means you may need a different dentist. Now here's the part that's going to surprise you. There is a whole category of dental problems where the right answer is somewhere between do nothing and root canal, and that whole category is invisible if you only walk into one office. Question 3. What are the alternatives, including doing nothing for now? This is the question I wish every patient over 50 would ask. Let me list the real options that may exist, depending on your specific situation, and that ought to at least be on the table before any final decision. There is direct pulp capping or partial pulpotomy, which I just described, saving the nerve. There is observation with a temporary medicated filling, which in some cases lets a borderline tooth declare itself one way or the other before any irreversible procedure is done. There is ozone therapy, which is a tool I use in my own practice, medical-grade ozone gas applied to a deep cavity or an early infection to disinfect without an aggressive cleaning out. There is, in cases where the tooth genuinely cannot be saved, extraction, followed by a careful conversation about replacement options, including a partial denture, a bridge, or an implant. None of those is automatically the right answer, but a dentist who walks you through them, even briefly, is being honest with you. A dentist who refuses to consider any of them, and I am not anti-dentist, let me say that clearly, I am pro-informed patient, is not. Now, I want to be very fair. There are real situations where a root canal is the right answer. A tooth with a confirmed dead pulp and an abscess on the X-ray that the patient wants to save. A tooth with a confirmed irreversible inflammation that is not a candidate for vital pulp therapy. A tooth that is structurally sound and worth keeping. In those cases, a well-done root canal is a beautiful piece of dentistry. The point of question 3 is not to refuse the procedure. It is to make sure you are choosing it with full information instead of being walked into it. Question 4, if I do need this, who is doing it and how? A root canal done by a general dentist in 20 minutes between two other patients is not the same procedure as a root canal done by a specialist, called an endodontist, with magnification, rubber dam isolation, and modern instruments, taking the time it actually takes. The success rate of the second is dramatically higher than the success rate of the first. In studies of long-term outcomes, technique, isolation, and operator experience are some of the largest predictors of whether a root canal-treated tooth lasts 10, 20, or 30 years. Ask whether your dentist does this themselves or refers to an endodontist. Ask whether they use a rubber dam. That's the small sheet that isolates the tooth from the rest of the mouth, because if they don't, the procedure is being done in a contaminated field. Ask how the canal will be sealed. Ask what biocompatible materials are being used. These are not exotic questions. They are the questions any honest practitioner will be glad to answer. If you only remember one thing from this video, let it be that the difference between a great root canal and a rushed one is enormous, and you have every right to ask about it. Now, here's where the gap comes in. There are deeper conversations and tools that go beyond what I can responsibly describe here. Ozone protocols, biocompatible sealing materials, specific imaging like cone beam C, T scans for complex cases, whole body considerations, some holistic dentists weigh in. Those require a trained biomimetic or holistic dentist who knows your specific situation. I won't walk you through DIY versions because there is no DIY here. The value is knowing the questions and knowing the options exist. Let me tell you about a man I'll call David. 61, accountant, came to my office with a referral for a root canal on a lower molar. He was in genuine pain, had not slept well in 3 nights, and had been told the tooth needed a root canal and a crown by Friday. Total cost over $4,000. When we sat down and went through the 4 questions together, the picture changed quickly. The pulp had been tested only with a cold spray, which had given an inconclusive result. There had not been a careful look for a crack, even though his pain was sharp and location-specific when he bit a certain way. We did transillumination. There was a hairline crack running across the cusp of that tooth. Not a vertical root crack, those are unsavable, but a shallow horizontal crack on the chewing surface. We removed the cracked piece of cusp with very conservative biomimetic technique, sealed it, and the tooth went quiet within 48 hours. No root canal, no crown. That was 3 years ago. The tooth is still there and still alive. David told me he sometimes still drives past the original office and feels his heart rate go up. David is not unusual. David is one of many patients I have watched walk in for one procedure and walk out with a different, better, more conservative answer, simply because someone took the time to ask the questions properly. Here's what 25 years in practice have taught me. The most powerful tool in the dental chair isn't the drill, and it isn't the root canal file, and it isn't the crown. It is the question you ask before any of those touch your tooth. A root canal is sometimes the right answer. A root canal in the wrong tooth, at the wrong moment, by the wrong hands, is one of the most consequential mistakes a person can make with their own mouth, because it cannot be undone. You do not need permission to slow this down. You do not need permission to ask for a second opinion. You do not need permission to say the words. Before we schedule anything, I have 4 questions. A real dentist, and I say this as one, will welcome those questions, sit down with you, and answer them carefully. A dentist who is offended by them is telling you something useful about whether you should be in their chair at all. If this were my own mother sitting in that chair, here is what I would want her to hear. Slow down. Ask. Choose. Let's pull this together. Before agreeing to a root canal, ask whether the pulp is actually dead or just inflamed, and demand a real diagnostic answer, not a guess from pain alone. Ask whether vital pulp therapy or another nerve-saving option has been ruled out and why. Ask what the alternatives are, including ozone treatment, observation, biomimetic restoration of a crack, or, when truly necessary, extraction with a careful conversation about replacement. And ask who will be doing the procedure, with what isolation, what materials, and what level of training. Those 4 questions, asked calmly, and he will tell you almost everything you need to know about whether the procedure on the schedule is the right one for the right reason. If after all 4 questions the answer is still that you need a root canal, then you go in informed, with a practitioner you trust, and that is a very different experience from going in scared and rushed. If the answers don't add up, you go get another opinion. Most teeth do not need to be treated this week. Most teeth can wait long enough for you to think clearly and consult a second professional. That alone has saved my patients more teeth than any technique I own. You are not a passive patient. You are an active participant in your own care. The dentist holds the instruments, but you hold the choice. In the comments, tell me, have you been told you need a root canal? And which of the 4 questions do you wish you had asked? I read them. If this helped, hit the like button, subscribe, and share it with someone over 50 who needs to hear it. Take care of your teeth. They're irreplaceable. I'll see you in the next one.